This lecture will be on some heart topics, namely a congenital heart defect called dextrotransposition of the great vessels, where the aorta and the pulmonary artery, those two are great vessels, are switched from their normal positions. To begin to understand detransposition of the great vessels, remember that blood leaving the right ventricle should take the pulmonary artery to the lungs to get oxygenated, and then return to the heart and enter the left atrium. The oxygen-rich blood that next leaves the left ventricle should take the aorta to distribute to the rest of the body, and then ultimately it should re-enter the heart at the right atrium. If one, the right ventricle, feeds instead to the aorta, and two, the left ventricle feeds instead to the pulmonary trunk, and pulmonary trunk is just another way of saying the main pulmonary artery. If these things happened, you'd have a major problem. Right ventricle to aorta to body to right atrium to right ventricle, this circuit would never go to the lungs. And the left ventricle to the main pulmonary artery, to the lungs, back to the left atrium, and then to the left ventricle again, this circuit would never go to the body. This is, in fact, what we have with detransposition of the great vessels. If you think of normal circulation as sort of a figure eight shape, in this disorder we would have instead two loops next to each other, but separate from each other. Both detransposition of the great vessels and tetralogy of Fallot are conotruncal abnormalities, problems with outflow tract formation. We happen to be a little more interested in the truncus part rather than the conus part of conotruncal. Conotruncal abnormalities are a subset of congenital heart disease. And let's make sure we know congenital does not mean the same thing as genetic. Congenital just means present from birth. On chest x-ray of a patient with detransposition of great vessels, we can find an egg on a string appearance. The D of detransposition is for dextro. There is, in fact, a levotransposition of the great vessels, but you'd have to ask a cardiologist about that. The great vessels are that are associated directly with the heart include the ascending aorta, the pulmonary trunk, pulmonary veins, and the superior and inferior vena cava. And we're just interested in the outflow ones, the truncus ones, so the aorta and the pulmonary trunk. And the disorder is called transposition, although I've wondered whether it could have been called a failure to transpose. The deal is that a cardiac neural crest derivative called the aorticopulmonary septum, this fails to spiral during development, which is why the roles of the aorta and the pulmonary artery are not correctly established. So we end up with separation of systemic and pulmonary circulations. This is not compatible with life unless there's an additional leak of sorts, allowing mixing between the two systems. One example that will work is a VSD, ventricular septal defect, which aren't that uncommon anyway. In any case, the patient will need surgery. Detransposition of the great vessels has an association with maternal diabetes. This means the mom already had diabetes and maybe didn't manage her blood sugar levels during pregnancy. Cardiac looping begins early on in week 4 of development. And I think it's because of this early timing that we do mean maternal diabetes as opposed to gestational diabetes. Yes, in both cases, we do mean that the mom is hyperglycemic while she's pregnant. But when we say gestational, we mean that the diabetes started during pregnancy, probably because of the physiological changes from the state of pregnancy. So gestational diabetes would be too late to have an effect on heart morphogenesis since it starts so early, like in week 4. Um, so the mom needs to instead have already had the diabetes. In other words, we call it maternal diabetes. Okay, let's tie it all up. Detransposition of the great vessels is associated with maternal diabetes. The embryologic pathoetiology or pathophysiology is that the aorticopulmonary septum fails to spiral. As such, the aorta and pulmonary artery don't do their correct jobs. And we get a pulmonary circulation that's just separate from the systemic circuit. If the patient has a shunt, like a ventricular septal defect, the patient can survive, but they will need surgical correction. Oh, yeah. And you can see on chest x ray a heart that looks kind of like an egg hanging by a string. Okay, that's it for this one.